Welcome to Simply Women's Health with CJ. I'm your host, CJ. Today we're going to talk about birth control. I would like to provide an overview of your birth control options. The purpose of birth control for today's discussion is literally just that, preventing pregnancy. So there's a number of different ways to prevent pregnancy. The most reliable, the one way that I can guarantee you will not get pregnant is if you are either abstinent or if you are in a same-sex relationship. Otherwise, if the penis and the vagina are in the same room, there is always a chance for pregnancy. So if abstinence in same-sex relationship does not work for you, we do have some other choices. One way is natural family planning. You monitor your menstrual cycles, you keep track of your fertility on an app. It's very, very safe. Not the most reliable for those patients that can't adhere to the scheduling and the monitoring, but for those people who are very in tune with their body, it can work very well. There's also condoms. Condoms are great. Condoms also, in addition to decreasing the risk for pregnancy, also decrease the risk for sexually transmitted infections. So I'm a big believer in condoms as well. The only thing with condoms is both parties have to be on board. And if both of you are not interested in using condoms, then they're really not going to work. For those patients who want to take a hormonal birth control, we have what are called combined contraceptives. Combined contraceptives contain both estrogen as well as progesterone. The progesterone is what prevents pregnancy. It thins out the uterine lining. It tells the ovaries to stay asleep for the most part. The estrogen builds up a little bit of a uterine lining, so you will have a scheduled menstrual cycle. It will be shorter and it will be lighter and it will be much more predictable than when you are not on birth control. The pills, you have to take a pill every single day. If you can't remember to take a pill every single day, it is not going to work for you. The another option is going to be the patch. A patch has the same hormones that the pill does. The patch, you wear a new patch every week for 3 weeks. On the 4th week, you go patch-free. That's when you have your menstrual cycle. It's nice because you don't have to remember to take a pill every day, but you do have to wear a patch all week. And some people will say at the end of the week, the patch is starting to look a little bit rugged. For those patients who want to have hormonal birth control with a scheduled menstrual cycle but don't want to take a pill and don't want to use a patch, we also have a vaginal ring. It goes up into the vagina. It stays there for 3 weeks at a time. At the end of 3 weeks, you take it out. You have a menstrual cycle. A week later, you pop in a new one, and you are on your merry way. It's nice because you don't have to remember to take a pill. It's not going to get rugged, but you do have to put your own ring in and out of your vagina. Not everybody's comfortable doing that. For those patients that don't want to be bogged down with scheduled dosing of birth control, we also have long-acting reversible contraceptives. Those are your Depo-Provera. It's a shot. You can have the implant that goes in the arm, and you can also have an intrauterine device. Those contain progesterone only. Again, the progesterone will thin out the uterine lining. It tells the ovaries to stay asleep. And for these products, it also changes the pH of the cervical mucus, making it hostile towards to sperm. These devices are actually 99.8% effective in preventing pregnancy. They are not without side effects. The birth control, the Depo does have a very high dose of the hormone progesterone. Progesterone makes you hungry, so there is a little bit of weight gain that can come with that on average 15 to 20 pounds. Now, Depo doesn't make you gain weight. Depo makes you hungry, so it's not the Depo. It's the increased hunger that goes with it. Those 3 will also have a fair amount of irregular bleeding, so you do have to kind of plan on that. After the bleeding resolves, typically after about 3 to 6 months, some women will stop having menstrual cycles. Some women will just have irregular bleeding. There's also surgical options. The vasectomy is one of my favorite. And then there's also tubal ligation. Those are very, very effective for preventing pregnancy, but they're not, you do have to go to the operating room, so those have some associated risks with those. This information has been provided to you not to replace a visit with your provider, rather to give you enough information that when you do meet with your provider, you have an idea of what questions to ask to best meet your healthcare needs. If you do feel as though it's been helpful, I would encourage you to like, share, subscribe, whatever you feel comfortable doing. That's it for today. This is CJ. I'm at your cervix.